Hey there, David at Bodyworks here again. Today we're going to talk about the quads. Now, a lot of massage therapists just generally work broadly over the front of the thigh, thinking they're working on the quads. But there are 4 distinct muscle bellies, and if you can distinguish each from each other and work on them separately, you're far less likely to have a client react with a lot of restriction to the work or tell you that you're working way too deep. Let's get to it. If you take one muscle belly, work deeply on it, and accidentally jump over to the other, it's going to clamp up, it's going to react negatively, and the client is going to feel unhappy about the work, even though you think you're doing the same depth all the time. So I'm going to think about Vastus lateralis, Rectus femoris, Vastus medialis, and then last but not least, we're going to go under Rectus femoris for Vastus intermedius. So for Vastus lateralis, all of your clients that are talking about, oh, I'm going to be foam rolling my IT band later. They're not foam rolling their IT band. The IT band shouldn't have the ability to change elasticity at all. And if you do actually create a change like that, you are damaging the leg. It's meant to be a very tight lever that doesn't change. So I'm going to take my soft fist right at her greater trochanter. I'm going to enter easily, and then I'm going to slide right down the lateral leg. And I can place my hips pretty far back and extend my arms, so I'm not using arm muscles to do this. I'm just leaning in with my whole body weight. And this can get very zingy under here, so I would not recommend going very quickly. Great. Next, I'm actually going to work directly on the separation of Rectus femoris and Vastus lateralis. So these big muscle compartments are separated by these very large structures called septum, which are basically like big pieces of fascia. And so you can really think about this diagonal line from here as being the septum as opposed to the muscle itself at all. And that has a very different feel to it. You're probably going to want to work on it with either a thumb, or if it's really too tight for your thumb, an elbow. But it is very sensitive, so you don't want to use tons and tons of pressure. Now, as you get close to the knee, I will say that there are some science studies that talk about a 5th muscle belly right down here. That hasn't, as far as I know, been followed up such that they're really starting to call them quints instead of quads. But some of these studies talk about it having its own nerves and its own innervation. Whether that's really true or not, it can be very helpful to think of it as its own separate muscle belly. And so that would start roughly at the lower third of the quad and come down diagonally through here. And that probably feels a little zingy, right? Great. So we just did lateralis, the septum, and this mystery potential fifth head of the quads, which would make them quints. Now I'm just going to come in lightly for Rectus femoris, and I say lightly, but actually what I mean is shallowly. So Rectus femoris is actually very thin, not very deep, and so what you want to do is think about getting almost parallel to the thigh and getting just a few millimeters into the tissue and then skating across the top. And that makes it so that you're really contacting Rectus femoris instead of Vastus intermedius. And this goes all the way up to the ASIS. So you really can just take your time coming up and up and up all the way until you reach the tendon at the top, which can get a little zingy, so don't press down, slide across. And you can just really keep going all the way up until you really get that ASIS or hip bone in lay terms. Good. Then last but not least, we can think about this inner diagonal as being Vastus medialis. This is on most people even more sensitive. Hi there. Now, getting that kind of precision of thinking of each of the parts separately and having their own lines will make it far easier for the client to handle deeper pressure in each of these. If you just plow through the top of the leg, you're really broadly catching 2 or 3 different muscles, and sometimes you jump from one to the other and it really can react poorly. So last but not least, we got Vastus lateralis, rectus femoris, this potential 5th head that, you know, science hasn't fully agreed on yet, and Vastus medialis. Underneath all of that, roughly covering the bottom half, is Vastus intermedius, the really big, meaty power muscle that actually extends the knee. So in order to get at that, you do want to think about contacting lightly and sinking down very, very slowly through rectus femoris, because if you contact too quick, it'll tighten up and not let you below it. And then once you get past that, you'll feel a deeper muscle that feels pretty tight, especially on Mary here, who's a dancer. And notice that as I really contact it and press in, I don't know if you can see this on that camera or not, but her heel is actually lifting a ½ inch off the table. And so I can just contact that and bring it down and slowly stretch that muscle. Does that feel like I'm on a different muscle than I was before? Yeah. And really the trick is light contact on the surface layer until it softens to let you to the deeper layer. You know, it'll take you a little practice to get the feel for it. There. And really, anything past here and you've moved off of it, that's about where it ends. It does not go all the way up to the pelvis. It stops on the femur. If I feel like I want to get a little bit more contact, I can come up and really think about going under rectus femoris with my thumbs and now contacting the deeper muscle, which shouldn't feel all that great. And now I'm going to have her very gently, what I want you to do, so notice again that your heel is lifted off the table. That to me means that your Vastus intermedius is very stuck and very tight. So I want you to lightly press your heel into the table, Mary. Good. And while you're pressing the heel in, I want you to flex the ankle and the foot back towards the knee. Yep. And let that go. Good. And I'm going to do a few passes like that. So what I'm really trying to do here, this is going to do a few things. I'm going to try and get rectus femoris and vastus intermedius to slide along each other, and that when she's flexing her ankle, I want all of that fascial line to be able to slide up the front of the leg. And so if rectus femoris is stuck to intermedius and she goes to flex her foot, she's gonna wind up using the entire thing instead of just using her tibialis anterior. So again, I'm gonna contact, there's intermedius, press the heel into the table, flex the ankle, keep flexing, good, and let it go. Yep, and that should make intermedius go, whoa. And again, press the heel down, lift the ankle, good, 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 and let that go. Nice, good job. And as I like to say sometimes, that's actually what a quad could feel like. Pretty loose, right? All right, last but not least, if I'm really still getting contact that lifts the lower leg like this, I can come in with my forearm. This is the most deep version of this. And I can passively move her lower leg and ankle myself. So Mary, this is gonna get up into that 7-8 range. Breathing. Go ahead and flex the ankle and let go. Good. And one last time, flex and release. Good. Nice work. All right, now that should feel very different than the other side. All right, so there's some really easy to learn and simple to incorporate quad release techniques. So if you like this video, we have some much more advanced techniques we can show you in our live pelvic realignment course, which is 2 days, 12 credits. It's 12 credits for New York State or any state that takes NCBTMB credits for continuing education for massage therapy. You can check out a link in the description below if you're interested and sign up for that course or any of our other live courses or webinar or on-demand courses. And if you liked today's video on quads, we really think you'll like this video next.